Welcome to the NSCHBC Edge Podcast, leading the way in the business of medicine. Now here's your host, Terry Fletcher.
Hello, everyone, and welcome to the NSCHBC Edge Podcast. I'm your host, Terry Fletcher. The Edge Podcast is brought to you today by the National Society of Certified Healthcare Business Consultants. Our goal is to discuss healthy business principles, have conversations on the business side of medicine, so that you and your practice can be profitable and successful for years to come. This week on the Edge Podcast, I welcome Janet Velazquez, JV Practice Solutions. Janet has dedicated 26 years and counting to the healthcare industry. Her academic background includes a degree in organizational leadership, business, and communication from Rollins College in Winter Park, Florida. And as a fellow member and business consultant with the NSCHBC, like myself, we thought it would be a great topic today to discuss retaining healthcare employees and what it takes, because that is a tough thing in today's climate. So, Janet, welcome to the podcast.
Thank you so much, Terry. I'm very happy to be here.
Yeah, and I'm really excited to have you because I've taken on a similar topic a couple of times, but not really looking at the environment overall in healthcare and what companies can do to really retain, their top talent, the people. And I hate to say that because that sounds so corporate, but retain people that want to be there, that really want to make the practice better, that want to serve patients. And without patients, we don't exist. So, in talking about that, I'm going to throw it to you and just, kind of ask you the question, what does it mean to retain top talent? What does that mean? I mean, I know I hear, positivity, being inclusive, supportive work environment, which doesn't necessarily mean what mainstream media says, especially as it, goes to healthcare. What does it mean in your job, what you do?
So, in what I do, great question, by the way. I think this topic is one of the most influential when it comes to the workforce for a variety of reasons. So, what I've learned over time, of course, through direct observation as well as just educational experiences, that there are some traits that top performers all share. And what we can all relate to is it usually incorporates things like strong work ethics, they're self motivated, they value accountability and communication, and they're committed to continual learning and problem solving, right? So, how does this contribute to the environment? Well, one of the things that we often forget in our work environments is the social norms of the environment. And so every organization has its set culture in the behaviors of how people interact, as well as what level of conversation they exercise at work, whether they're productive discussions to conversations to common visions and goals, which is primarily why the vision and mission of an organization is part of the business plan when they're designing it. And so it's important to remember that and recognize that when it comes to retaining top talent, because these are individuals that often come with levels of trust that they expect in their work environment and high ethical standards. And it's
And
usually why, you usually see that the contributing factor to running away a top performer is usually the work environment, how they're interacting either with team members, how leadership handles different situations within the workplace, or the number one reason of, nothing is going to run off a top performer quicker than a leader that is tolerating bad behavior in the workplace. Very demotivating for a top performer.
right, and I agree with that. And I think the one thing that's unique to healthcare, and correct me if I'm wrong, is you have the corporate, I guess I don't like to call it the work plan, but like you said, the business model or business plan. But when it comes to healthcare, you have how do I word this? So many different department and personalities to be able to make it function. And just as an example, in what I do, in revenue cycle management, I need people that are aggressive but professional, for example, in the collection department, in working with payers, but when they're also working with, patient statements and patients understanding their coverage, they have to have a little bit more compassion and empathy. But then you get into back office staff who, again, are working directly with the patients, front office staff, that's your first impression. And then you get the providers. And I think sometimes, again, it's missed for me because I've done so many on sites, that the first impression isn't the physician, isn't the provider, it's the staff that I'll give you a perfect example. And I know this, I've given this example, before in different talks I've given, and it just, I guess it stuck with me. So I share it a lot. I went into an orthopedic practice to talk to them about some of the things they were missing. And they weren't ready for me. So I was sitting in the waiting room in the most uncomfortable chairs I ever sat in, by the way. And there was a man that came in and he was on crutches and he had a cast on his arm and a cast on his leg. And they handed him a clipboard and kind of waved him off to go find a seat. And I'm like, first of all, he's on crutches and he can't be, he's not mobile. And if the person at the front was actually paying attention, they would have said, "Oh, sir, let me help you. Let me get you to a seat. I need you to fill out some," and helped him with it. He had a cast on his arm too. And, sometimes those things are missed, or when the patient's in the back, and I'm talking clinical staff now, understanding from the medical assistant to maybe the mid-level provider to the provider, it seems like it takes a lot of work to get to the physician. and and you're, in your position as, not just, I don't know if you do recruitment, but also keeping those companies to retain those staff, that has to be a big factor for you, not just, because corporate seems to put everybody in a fishbowl, but in healthcare, it seems like no, you have to have different personalities and different settings in healthcare.
Absolutely. And I love that you highlighted that because that's kind of why I always like going back to two core areas, which the fundamentals would be ethics and character, right? So that is all the way from the hiring process and making sure that we are being thorough and in alignment with our values and mission when we're hiring individuals, whether it's corporate or um, within both healthcare systems, whether it's corporate or private practice, right? Where ethics and character plays a big role, right? So you want to have team members that are in alignment with that care component of providing great care. And so when you hire correctly from the beginning in reinforcing those values and hiring towards those values, then it's much easier to teach the technical side, whether that is how we greet patients to making and implementing a patient experience that's going to be a great one for our patients, honestly.
Yeah, and it's funny because I've been involved in a lot of hiring practices for providers who like, do you know anyone? I said, and it's funny, about 20 years ago, and I have a weird quirk. I really like fast food coffee in the morning. Not necessarily their food, but I like McDonald's coffee, or, wherever I'm at, there's a place called, Farmer Boys next to me. I just like coffee, or their coffee. I'm not really Starbucks, it's too strong. But it's funny because when I meet somebody like at the drive-through window and they're just so nice and so, engaging. And I just think, boy, you'd be great at the front desk or great in a provider's office. And I remember I was talking to a client of mine. I said, you guys are in my town. I said, down the street, there's this gal in the drive-through, and her name is Stephanie. You might want to go check her out. Well, the doctor took my advice, and she's still there today. And she's, now one of their administrators. He said, best hire ever. So, when I think about when you brought me this topic, which I loved, that, top talent, you have to know that you don't just have to look through recruiters. You don't just have to look at, certain social media platforms. Their top talent can be found just about anywhere if they're willing to do the work and they've got that personality.
Absolutely, absolutely. It's funny. I love that you shared that because it is really, it goes back to character. And the first time I realized this, I remember picking up my son from daycare. He was pretty young back then, maybe a year, and they had a sign up in all different kinds of colors, and it said, "Attitude is just as important as ability."
I love
That
that.
was kind of this
Love
beginning.
that.
I absolutely loved it. And, even that, though that was almost, 2 decades ago, it made me realize that skill is something that we can teach. Character, not so much, because our character is tied to our value system. And so when we have good customer service and we care about others, right, which is most of us in the healthcare industry, then the processes and the workflow things, those technical skills can be taught, which is why team members like the one that you were able to recruit
It was funny.
is such a great fit. It comes across more organic, whether it's with our team members or our patients, right? It's more of an authentic transition when people meet someone new for the first time and they enter an organization.
And they understand, and and a lot of people, even in different realms that are not sectors that are not healthcare, they maybe want to break in. So, if I, to our listeners, keep your eyes and ears open when you find somebody that you feel maybe has that personality, that know-how, and I'm air quoting the smarts to really grasp something that you feel that they could be a trainable person in the healthcare field. If you need someone, embrace that. Don't think you have to always find that person with 10 years experience. There's a lot of up and comers now. One thing that I think is also tough, and I'm going to take a different turn on this. I was speaking at a conference one time, and this one revenue cycle management gal, she followed me around to different parts in the country. It's kind of funny. And she was never positive. And I was just like, oh no, she's here again. And she'd always sit up in the front seat, but she was very, very respectful to anything I was speaking on. And I just remember talking about collections or how to collect on, I think it was a heart cath or something that is a little bit difficult to collect with another procedure. And she raised her hand and she's like, well, that never gets paid. And I'm like, okay. So I came down off because we always put us in risers on the stage, came down off the stage, clipped on my microphone, left my hand mic up there and said, well, and came down by the front. So, most people would see, and I had 300 people in the room. I said, well, never's a long time. And I'll just, for lack of calling her anything else, I'll just say Susie. I'll just say, so, that's Susie, that's never's a long time. I said, have you tried this? Well, no. I said, okay, well, how about this? No. I said, well, why don't we try those things before we just jump into never? And maybe if you take the approach, I didn't say attitude, boy, Janet, I really wanted to. If you take the approach that, I'm going to figure out how to fix this until you've exhausted your efforts, then reach out and maybe not be a little, negative. I said you might have better luck. Well, the next time I saw her, which was 6 months later, she was much more positive. I mean, for her, but it was just, it's the approach sometimes. And I bring that up because one of the things that I've seen in healthcare, especially since the pandemic, is that a lot of employees, a lot of people you're trying to hire, they immediately say, I want remote work. And that's becoming tough since the pandemic was 5 years ago and public health emergency ended 2 years ago. And then but they still want the top salary that you got for commuting. How do you deal with that? I mean, because, you do save money, you save time, you save some things from working at home, but sometimes I think staff members lose sight of that a little bit. And I'm trying to be sensitive in saying that because I'm probably going to get some cards and letters on that.
Absolutely, great question. I think my my thoughts on those scenarios is that if we treat just the symptom, right, we create a strategy that only addresses the salary component of the team members that want to work from home. Instead, what I would suggest would be really identifying the root cause, which for me, what I have seen is we've got a society issue as far as how we interact. I think most people would agree that the reasons for wanting to do at home work or remote work for most that fall in that category come from a place of the challenges that come with interpersonal communication, whether that be with their team members to the general public. And so I believe that if we address those issues at the root, it may help solve the causes that we're seeing of these individuals. So as leaders, we could really make an impact by focusing and creating more positive environments. I think will create the landscape for inviting those individuals back in. But we've got a lot of people just kind of scared to go back into the workforce and not know how to handle some of those tensions and stresses.
Yeah, I agree. And it's interesting because I read somewhere a long time ago, it said The reason that employers give only 2 weeks vacation at a time, for the most part, is because anything you do for 2 weeks is a habit. And if you do it for longer than that, it's hard to go back. Kind of like vacations or being on a diet or whatever. So if you stick with your diet for 2 weeks, you'll probably continue. And I thought that was an interesting concept. And I saw this, after the pandemic where when people were opening back up their offices, especially in healthcare. I mean, it's hard to do a lot of things remotely. And I think that especially the providers, I mean, they have to be there. Obviously, there's telehealth, but you can't do surgery through telehealth. Um, I think the one thing, and this is again, I appreciate your knowledge on this. How do you address managers or people in authority, administrators, even the providers that want to be in charge? How do you address the authoritarianism that sometimes comes with that position versus getting people to want to work with you, not just for you? How do you address that? Because you also, I mean, you and I both know you can't always be their best friend, and you have to have some kind of, I hate to use the word control, but you have to have some kind of boundaries. So how do you address the not to get too far over the top, not micromanage, let people do their jobs with trust, but also not let things get away from you?
Great question. And I will say it's the area that I focus in most
I would think,
because
yeah,
yeah, I truly believe that we as leaders are the ones that have to set the landscape. And in order to do that, we have to portray a commitment to continuous learning and to problem solving with our team members to show them those skills. So, the traditional or old school way, right, as often referenced of being authoritative in our work environments, that has gone away, right? We're working with a new group of people that require more creativity. And it's healthy for us, that have been in leadership for a long time to learn and to challenge ourselves to be flexible in the mind. So when I say attitude, it really is a posture of the mind. And it has to start with the leader in the commitment of realizing that it's okay to be vulnerable in our workplaces. We don't have to have control over all things. And really, the most important thing that we need to establish with our teams as we lead them is the trust component. And, they have to get from us that we care about them as individuals. I
yeah,
think a lot of times as leaders, where we may fall short is for the authoritative style, they get so task focused, right, that they forget the human part of interacting with their teams. And
I
that
agree.
creates so much damage.
Well, I always talk to my daughter about this because she's 30, but she's a high school teacher and in Arizona. And one of the rules they have out there is kids can go to high school all the way up to 22 years old. Crazy, right?
Yeah.
Yeah, and I was like, "Whoa, okay." But because she's got a good percentage of her students that are for, adults, they don't always feel that they have to follow the rules of the kids. And she's, been had name called and everything, and she's such a compassionate teacher. And she said, "I have to tell you, how this worked. One day I had a kid that was 19 and he just felt that he could call me, vulgar names and really be obnoxious. So I needed to send him to the office." She goes, "But I did something a little different in front of the whole class." And I said, so whatever his name was, so and so. She's like, "It makes me sad that you think you can treat me that way." She goes, "Because you're one of my brightest, smartest students." She goes, "I actually thought you were going to be a doctor, because of how smart and how much you retain this." And he goes, "What?" She goes, "Yeah, you're one of my smartest kids." She goes, "I love having you here." And she goes, "He wasn't one of my better students as far as attitude." She goes, "But he actually knew the material." And she said, as soon as she said that to him, she said she totally saw his demeanor go, "Okay, I'm really sorry, Mrs. So and so. I'm really sorry. Can I please stay?" And she goes, "Well, no, you do have to go up to the office, but maybe tomorrow can be a better day." And she talked the administration out of suspending him. He just got a detention. But she said she saw a difference. And I bring this up only because sometimes I, I don't see and I know people are like, "I don't need the praise." People need to know they're doing a good job. They need to hear somebody tell them, "You know what? This is great work." And I think people miss that. Even adults need to hear that. Do you agree?
I definitely agree. But I also think that in adding to that scenario, that the appreciation component can be demonstrated in a variety of creative ways. Some need the physical component of a tap on the back or a verbal
Right.
reassurance, and sometimes the most influential, like the story that you shared, is how we help others by holding them accountable in realizing what they're doing so that they can change.
Right. Because she
And
still didn't let him get away with it. She's like, no, you still have to go to the office. You can't call me names, but hopefully tomorrow's a better day. And I think that was I was so proud of her at that moment because she's like, yeah, I definitely wanted to say get out. But she's like, sometimes you can't say that. She goes, I'm a teacher. I'm here to help them. And relate this back to our conversation on administrative and people in charge and management. And I know you deal a lot with that. And, understanding that maybe they're just not having a good day. Maybe they're not feeling confident in what they do. I've heard that a lot of people in healthcare, especially in the sector I'm in, revenue cycle management, a lot feel they haven't been trained, and it's frustrating.
absolutely, I couldn't agree with you more. I love that she went back with the accountability component because that's where boundaries and accountability tools can be used to really help individuals for the light bulb to go off. And those can really be influential moments in people's lives for change. So I love that she did that.
Yeah. Now I
Is
have a
it
question
hard?
for you, and I'm going to change gears here a little bit.
Yeah,
One of the things, and again, this is again going back to our topic about retaining that top talent and environments matter. One thing I think, and maybe I'm wrong, but I think people miss something about continuity of care. It's essential for patient outcomes. And when healthcare professionals can stay with an organization long term and develop strong relationships with patients, understand their medical histories, acknowledge them when they come in, knowing them personally enough, I think it's so important because high turnover can lead to disruptions in that care, medical errors, patient satisfaction, and every payer now is sending out those surveys. And it also makes people, I think patients feel a little uncomfortable because now they have to tell that new person their history again. And, do you ever bring that up in your conversations?
absolutely. Absolutely. It definitely impedes on patient care. And what you've described really is, you know, uh, the importance of psychological well-being, right? And as leaders, and it's why I start with leadership in making sure that they first address maybe concerns or root issues that they're having so that when they show up to work, they're their best selves. But much like the colleague that you mentioned earlier, we have to have emotional maturity as leaders. And therefore, we've got to help get to the root of why these team members are not 100% present in their work, right? Because it shows up in our work, right? Patients are going to be able to tell when we're not as thorough or we don't have enough training. Right. There's an issue there where that team member hasn't provided whoever his direct report or employer is with information and saying, hey, here's what I need to successfully be able to do my job or to continue to improve. And here's how I'd like to do it. That
Right.
confidence isn't there. So if we work on just really quieting the mind in the workplace so that they can focus on their work and the quality of work that they're delivering to patients, then we can really make an impact on how long our team members stay with us and how impactful we can be in our patient care.
No, I agree. And I think, we've really talked about fostering a supportive and inclusive work culture. Employees need to feel not only valued and respected, but for me, the top things, they need to feel heard. Sometimes, they just don't feel like you're hearing them, you're not listening. And, so if you're out there and you are an administrator or a manager or in charge of anybody, if you're a provider, listen to your employees. You just hear them. It not you can't we can't always tell them things are going to completely change, but if you hear them, then at least they know that they're respected enough that their opinion matters. And the last thing I wanted to bring up, and just in kind of wrapping this up, we got to talk about money. So how do you, I mean, we have to talk about that or people are going to go, yeah, but what about my salary, my benefits and all that. So How do you, because salary isn't the only factor, but it's a significant one. How do you look at fair compensation as far as not just salary, but benefits and, time off, all that kind of stuff?
Great question. To answer just very briefly your question about the team members and how they can really communicate their needs to their superiors. I often say to doctors and to leaders, look at it like a treatment plan. We give our patients a treatment plan for their course of action for treatment. They may not complete the 3 pages in a year, and set that expectation, right? But at least do one at a time with team members, because you need that buy-in from your team members in order to have them commit to your company long term. And so even if you don't do change fast, start with just the most important thing for them, but definitely make time to address those concerns.
Yeah, no, I
In
agree.
Absolutely. In regards to compensation, absolutely, fair compensation and financial growth is very important to everyone, right? And it's very important that we stay competitive, but we also need to make sure that there's money in the pot to be able to do that. And so, where I see a lot of administrative error that happens is we see a lot of lost revenue in areas where it doesn't have to happen, which could be directly correlated with the lack of training that you were mentioning earlier, right? And so, as leaders, if we pay close attention to anywhere that we can optimize within operations to increase revenues or create treatment plans, if you will, as I mentioned earlier, for team members in order to increase profitability for the practice, then it becomes a win-win for everybody. And so it's important to exercise behaviors that are going to promote that win-win component instead of a one-sided component of just the team member gets a raise.
Yeah,
And I
no,
will
I
say, just
agree.
to add to that, making sure when you do give raises that they are valid increases, for performance. We don't want to be reinforcing um, bad behaviors or no behaviors really that are increasing the profitability of the organization.
I agree. And also get creative with, with things that you're, and I'm air quoting, compensating, your staff with too. I'm talking to our listeners, healthcare work sometimes requires 24/7 scheduling. So work-life balance is kind of non-existent, whether it be providers, sometimes the staff members. So giving employees some control and flexibility as far as their schedule, staggering schedules. Maybe if you don't have the financial way to give a raise or anything, maybe give a half day off a month, if that's a flex day that they can go take their kid to the doctor, or they can go, see their one of their kids play in a soccer game, or they can just take a, mental health half day and read a book. Just try to be flexible when it comes to really giving employees some flexibility there, and that would go a long way as well.
Absolutely. And even little components in the workplace, order lunch,
Yeah.
do something nice for them in the morning so that they feel welcome. Some offices have, a coloring pad on the wall, to kind of just de-stress in the middle of the day, whatever it takes. But ask your team for suggestions, what would help them de-stress also throughout the day. And then, of course, lastly, outsource what you can. There's a lot of technical tasks, like especially within revenue cycle management, that can be outsourced so that they can be more people focused and minimize the workload. That will absolutely help with burnout.
Yeah, no, I totally agree. Well, we would like to thank Janet for being on our podcast today. We appreciate your insights into this important topic in the business of medicine, probably one of the most important topics. So thank you for being here today.
Thank you so much for having me. It's been a pleasure.
You can find the contact information for Janet at nschbc.org under Find a Consultant tab. Type in Janet's first name, and there she is. As a reminder, the nschbc.org website offers monthly free webinars on a variety of topics, as well as a quarterly Medicare webinar update. For all educational offerings, go to the nschbc.org and click on Upcoming Education tab. That's it for me today, everyone. Please join me next month when we once again bring you current and important topics in the business of medicine. Everyone, make it a great day, a great rest of your month, and thank you for listening to the award-winning NSCHBC Edge podcast. I'm Terry Fletcher.
Thank you for listening to the NSCHBC Edge podcast. Join us on the second Tuesday of each month as our consultants tackle the complexities of navigating the business of medicine. You can reach us on the web at nschbc.org, the National Society of Certified Healthcare Business Consultants.